RS3PE, remitting seronegative symmetrical synovitis with pitting edema, is an uncommon inflammatory rheumatic condition. It is characterized by the following features. Key features. 1. Remitting. It tends to have a good prognosis with a tendency to go into remission with appropriate treatment. 2. Seronegative. Patients with RS3P typically test negative for rheumatoid factor, RF, and anticyclic citrullonated peptide, anti-CCP antibodies. 3. Symmetrical synovitis. It presents as a symmetrical inflammation of the synovial joints, especially involving the wrists and small joints of the hands. 4. Pitting edema. A hallmark of RS3PE is the pitting edema of the hands, which can sometimes extend to the feet. Clinical presentation. Age most commonly affects older adults, typically those over 60 years old. Onset. It usually has an abrupt onset of pain and swelling in the joints of the hands, often accompanied by stiffness, particularly in the morning. Systemic symptoms. Some patients might experience fever and general malaise. Differential diagnosis. RS3PE can resemble other conditions like polymyalgia rheumatica, rheumatoid arthritis, and paraneoplastic syndromes. Distinguishing factors include the presence of pitting edema, absence of serological markers like RF, and its characteristic response to low-dose corticosteroids. Management. Corticosteroids. The condition generally responds well to low doses of corticosteroids like prednisone, often showing rapid improvement. Prognosis. Most patients achieve remission within a few weeks to months, and many can taper off medications after a period of time. RS3PE should be considered in older patients with acute onset of symmetrical synovitis and pitting edema, especially if seronegative for other typical markers of inflammatory arthritis.